Okay, so her issue is prolapse bladder. They keep getting her to drink more and more water. She can't hold it. She keeps leaking. She keeps wetting herself. She has to run off to the toilet. She can't do this. So she eventually gets in. She keeps trying to fill her bladder. They keep putting pressure all over her for an ultrasound. We already explained was not required. So I go in there, what are you doing? I am doing the ultrasound of the uterus. I asked you to do an ultrasound of the lower pelvic region. And then it was, okay, my bad. So Lolita Kund only speaks Russian. Okay, so I did become a jerk. I didn't have a translator, so I only have the Nishta. Neither the husband doesn't speak any English. The mother speaks a bit, but they're both Russian. Denishta speaks not a word of Russian. So I'm going in there, but I'm talking to Lolita Kun in English because it's the only one I know. And yeah, I'll get there. And so he suddenly says something to me about speaking Russian. I said, no, I'm not speaking Russian. I'm speaking English. And he goes, and I kept talking to him in English. That's all I got. That no, I asked you for an ultrasound of the lower uterus, lower pelvic region, because she has a history of prolapse. And he goes, Mataji, I don't speak Russian. I don't speak Russian. And I kept speaking over and over. I don't speak Russian either. Do you understand? I'm saying this in English. Do you understand English? And he goes, yeah. So I have to call, anyway, it gets ridiculous. I call the doctors, I call Hari Leela, blah, blah. Again, Denise is with me, but she's well trained as a nurse who is a handmaid into the doctor and just says, yes, sir, how high. Anyway, so the final thing is he keeps saying these stupid things to me. And the final thing is, Mataji, we cannot do an ultrasound of the bladder because the baby is in the way. I know who this is. I knew it was. And there's Denishka. Yeah, because it's cold. See, this is why I insisted you guys all show up today. Honestly, usually I don't care, but I need all the bodies in this room I can get because I'm freezing. You can sit in the chair and move the chair onto the rug if you like. There you go. That's the only reason. Look at me. Lawyers are supposed to dress like this. Okay. So what was it? Okay, so I'm pissed off at this point, and he says the bladder's in the way. So the baby's in the way of the bladder. So I asked you all to get out your anatomy books and tell me, where are you doing an ultrasound from her back? Or is she lying on her stomach and you're doing an ultrasound from her back? That's the only way the baby's going to be in front of the bladder. So he sent us off for an MRI instead for a woman who's pregnant. So
it's not good for the baby.
No.
Radiation.
Ultrasounds aren't even good for the baby.
Yeah, but this time they actually inject you with something.
Yeah.
In the hospital, pregnant women keep out. They have a warning sign for pregnant women. Radiation high zone. Keep out.
The whole thing, even the area. What to speak of injecting it, and I've been injected before. You feel it. It like burns through you, and then it goes like ice, and then you can see your eyeballs. And you actually see the circuit. What is it? Circulation. Your blood circuit, because it's going through the circulation.
You can see
You can actually see you see your veins and your arteries, or not arteries and veins, but the capillaries
Yeah.
are actually blue. You see a blue purple glow going, and that's how I can see where my
And now we're not doing an MRI.
Yeah.
it. What's
It's a
It's a
dye.
radioactive dye, so it can be picked up on the machine.
the dye in your body?
Oh, you have interesting colored urine for about 12 hours or maybe the next day. And it's really interesting because I live off the land, so I don't go through, I don't have a septic system like you guys. You can smell that shit, that stuff, and I feed my plant, so I actually unplug it. I have a system. So when I do stupid tests like this, I'll go outside and just pee on the grass. I'll pee on the weeds.
Yeah, because I was like, so
Pee on the
you
weeds.
killed your grass. That's all I heard. I killed my grass. No, you
No,
killed
I
the
pee
weed.
on rat's tail.
So you killed the weed.
Yeah, it kills grass.
Okay, so we've gone for an MRI. Did we actually?
No, we
get
did
the
not go through an MRI.
Okay,
I've told her to
okay.
get up and go. So, okay, so we're at a standstill with this one. I did go back, okay,
Couldn't you call Dr. Suki and be like, mate,
I
where's
did.
the bladder?
I did. I told him exactly that, and he had the same reaction. He just said, I said, well, the end response was, we couldn't do it because the baby's in front of the bladder. And he just looked at me, oh, he had a sarcastic response on my side. You know, he knew that was ridiculous. So he, that just didn't get me anywhere. He said he'd get back to me. I had to go to the other doctor, the one who's married to the Russian lady. Tomek.
And he doesn't like you.
No, he doesn't. Has he been, did he tell you?
You told me.
No, he doesn't like me.
He's also an arrogant prick. I
He
read
is.
when Dr. Suki at least pretends to. Dr.
Well, he
Stomach
certainly
was like,
does when I yell at him. When I go all ape on him. So, look, none of them do. This is the problem. This is the problem. None of them have that kind of respect. So a midwife I'm taking online course from does it. She has a small tab and some software, I guess, but she says it's very basic. Can you do it? Oh, sorry. What information do you need from the ultrasound other than making the diagnosis? Is it possible to learn to do ultrasound as a midwife and do it yourself? Midwife, she has a small
did you
tab,
applying to
Lab.
small lab and some
No, she has a small tablet, and on that there's some software, software installed, and she has some instruments. Of course, she has that,
Oh.
yeah. And she does the ultrasound herself, but she says it's very basic. I can't do very detailed analysis, but the basics if I want to know and don't want her to go to a hospital. Because she is also, I think, in a very remote area. She deals with a lot of Amish people. And when she told us about it, I was like, yeah, you spoke about Amish people. I had no reference point, but I had that reference from you. So she works with a lot of Amish people. So she has a small setup. I can ask how she got all of that.
you can buy everything online now.
You could buy it. It just depends how strict your country is. But look, where there's a will, there's a way. You can get anything. I managed to get anything. So yes, now that you mention it, I am aware. I have seen these machines. I never thought of it for myself because I don't know how to read the damn things. I mean, even if I'm thinking,
YouTube how to read. You can learn anything on YouTube.
I don't know. I mean, even so, you look at people's ultrasounds or live ultrasounds, and I mean, some things you can see. So, I mean, when you start seeing lots of detail, those are really expensive and good quality machines. You're not carrying them around on a rickshaw, or on a scooty. I don't, for what I wanted to use it for, I don't think it would have helped me because I'm definitely not familiar with dissecting a body. So I think I would, well, meaning I would actually
You've
want
never
to,
dissected a body?
a human body, cadaver, no.
Oh,
I have done a cane toad. Well, I watched a
You
cane
haven't.
toad. I didn't do it. I watched it.
Fish.
No, it's a toad.
I watched somebody
A
doing a
buffo.
fish. They shoved the scalpel into my finger, which was covered in a glove, and my glove filled up with blood. That ended really bloody fast.
No, I didn't need a
Exactly.
for that. My stepfather forced me to dissect fishes.
I've been there and done
And
that.
meat.
So,
Oh,
so the question about the, what can I do? Okay, yes, I want, you can manually diagnose. And so this is what happened with this woman. I did go there. I did look and see everything. I shared pictures with you guys, I'm pretty sure. And on view by visual examination and some palpation, I could determine that it was indeed the bladder that was prolapsed into the pelvis. But I wanted to confirm my thoughts. Now, the next step, okay, that's what I mean to say. So I palp, I feel, we look. Next step, you want to put your fingers inside and have a good feel around, do PE, pelvic exam. I mentioned the word pelvic exam once, and I also mentioned the word pelvimetry. In this case, I'm not doing pelvimetry. I'm doing a pelvic exam. I'm examining her soft tissues. So again, because I'm lazy and I knew that no matter what I did with my hands, the next step, technically, professionally, if you're going to tick all your boxes in a row, the next step you do is go get your manual interpretation confirmed. It's just something we start to do, right? Okay, let's back up, because now we have all these new
Could I-
tests.
Plastic things behind you, please. Yeah.
So now that we have all these tests, so we keep running, you know, make sure we're all right with all those new tests that we threw. Wasn't that picture? Oh. Okay,
Wall.
it's cold. Thinking. So I should have done the PE first and then sent her off to confirm what I did, confirm what I found. But this is what happened when we tried to get the ultrasound. So then we went back home and decided to try to do the PE. Now, I'm not a pushy person. So the moment I touched her,
okay.
no kidding,
So,
no kidding. The moment I touch her, she flinches. Now, the only people I've ever seen do this are teenage girls and Indian women. This woman's Russian, she's not Indian, and she's doing this. So I immediately stop. I'm not going any further. I explain what's going on. I don't want to, you know, add pain and injury to anyway. So I give her, we prescribed sitz bath, steam and heat, the moxa stick. I think those were the two things, the moxa stick and the steam bath. Then I wanted to go through the homeopathics. Eventually I used one of my friends who's a homeopath. And so she went and spent some time with her. Later, this woman and I had a conversation about what she prescribed and why, and then we just shared information about this mother. I felt there were issues emotionally with her. She does have a lot of issue outside influences of family, I think are professional or work within the medical industry or something, and they were going to their friends and all their friends are freaking out. The mother's on the phone and handing the phone around to all her associates who can yell at the mother. So, you know, needless to say, the bladder falls out completely. No, it didn't, but you get my point. You know, it wants to. Okay. So I've seen these messages. This is the first time I've seen a bladder prolapse in pregnancy. Normally it's that uterus is in the way of everything and everyone.
I thought it's after birth that we're looking at it. It's in pregnancy. I am
She's pregnant,
lost.
she's 28 weeks, 29 weeks pregnant. Yeah, exactly right, and this is her first baby. So then we do, okay, so going into her history, we find out that she had kidney stones and then she had surgery, laparoscopy surgery, laparoscopy, scopic surgery, which is the, you know, the little tool you go inside. And they went through her bladder and pulled the stones out through her bladder. So this causes a little trauma, don't you think? Afterwards, there was an infection and including in one of her ligaments. Does everything sound like it's adding up to you?
Yeah, contraindication.
Complications, all, yeah, contraindication.
Leads to more medical intervention.
Yeah, yeah. So here we go. Now this is the situation. I have not gone back yet. I've just been very, very busy or just not kind of out of it with this eye. So it's something, this is on my mind, it's on my board. Look at her. Before I move on, because that's where I'm sitting with it, I don't have a conclusion yet, that's where I sit with it. Does anybody have questions or anything you input or, yeah?
I was thinking maybe he could not get what he needed because all he knew how to do was what he was doing.
He's an ultrasonic tech. Can you answer that?
Is that possible? Could that be a possibility why he couldn't like do what she was
Yeah,
required?
one thing is he said about the protocol that we can do only witness. That's the one.
That's my point. It's
Yeah.
probably a reason
But-
why he can go beyond.
But the other thing is that on one more, I think it came on Tuesday, I think there was one more doctor who did the fetal profile and he said we can do that. So this contradicts, right, two things.
Yeah,
One says we cannot do, and other says we can.
maybe he cannot do it. Maybe he doesn't know how to do it.
But as I spoke with the Dr. Somi, he said it's based one of the best ultrasound. But that's not.
So to recap. Yeah, it's true. As I said, this woman went to, had an ultrasound before 2 days earlier. They did the exact same, not following me, which is why I went in the second time. And Denise and I both went in the second time to ensure that she would get the right ultrasound. The next time it was a different doctor from the first time. I think that you had a conversation with the first one. Was that, did you speak to him?
No, but
What happened? How did it come about?
we got the call, I think we even got message from.
The Mataji?
Into like Mataji.
Oh, right, that
That's
they
how
did
we
the
did it.
wrong
Yeah.
ultrasound. Right, okay. Now I remember. Anyway, so the first doctor, after being confronted that this was the wrong ultrasound, he said, all right, come back in 2 days and we'll do it again. So, except it was a different technician in 2 days. And Denise,
Said, wait 2 days.
yeah, probably.
Freddie had enough.
That's true. She was, and it just, so that's part of the issue with why I'm scratching my head with both of these guys. And Denise also said,
Said that it can be done in partial bladder, like a partial full bladder. Why they wait for the full bladder? That's
exactly. So for a lower blood, when I'm doing an ultrasound of the lower pelvic region, we need to, when we're doing the uterus is getting big and they kind of look through water. That's why they want you to fill up with your bladder with so much urine so that they can see through and send the echoes nicely through to the baby. And they want your bladder as big as it possibly can be, which is why the rest of the screen is a little fuzzy when it goes out of focus. But when
Water from the amniotic fluid.
they want a window, and because the baby will be more close, there's less fluid between the body and the wall, right?
Okay.
Yeah, so they want more water to
It
send
just
it.
seems cruel to make a woman, a pregnant woman, hold a liter
Hell
of
yeah.
water
It's, and it's,
for an hour.
it's rude to make a woman with a prolapsed bladder.
Exactly.
That was lame. And as Denise is saying, no, you can use it to do a lower pelvic, you do, how, less bladder, partial
But
Partial
they are
bladder.
written in the report.
Yeah, they
Partially
did
female.
too. They
can
did.
be like that, postpartum resistance.
Especially if she's peeing it all out.
Honestly, it just sounds like Dr. Somek is closing ranks, and defending his colleague.
Well, this is another thing that's happening there. Yep, she's getting the tap on the shoulder. And this is true, actually, it's that this is
Which doesn't help
conversation,
anything. In fact, it makes things worse.
correct, but this is how they work in India. They think they're gonna tame me, but they're not. They'll lose me. They'll lose me, and I'm prepared to go, actually. I'm putting all my ducks in a row, and I'll get to that later. But they can kick me out anytime they want, and I'll actually make 26,000 rupees a month more. And then I'll keep 100% of my income. So, moving right along. Dun, 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 the bladder, this is what we found. It is most unusual, so, sorry, where were we? It is very unusual to see such a prolapse or such an event. I've never seen such a thing. What could possibly happen? She can't give birth. The bladder keeps prolapsing and collapsing into the pelvis
That's
and
what I-
pushes, I would think it's the same thing as a full bladder, right? Except, yeah, except with a full bladder, it just keeps growing. But this thing without growing is gonna collapse.
It'll cause a lot of pain and it'll probably require a lot of manual put back after delivery, if you were to.
I have
do
no
that.
idea.
You have to put a lot, you have to do that
Yeah,
maneuver, you have to
you
put
can
your arm in.
Wow, that's
Yeah,
interesting.
do a lot of that, and there'll be nothing to keep it there and have it.
There is
stay.
actually. So I did do some research. There's a thing called the pessary.
Okay.
So I had to use it. I tried to use it. I couldn't use it. It's a ring. It's a ring, and it can be as big as this or quite big, quite big. I think I tried to use this size. I had two sizes I tried. They're hollow, they're just donut shaped. They're about as thick as your finger, thick as my finger. You fold it in half, you insert it up into your pelvis. You're trying to get it up. Trying to get it up behind your pubic, kind of catching here. And then basically it's supposed to fill this area here. It fills this area. So it sits in there, and the idea was to hold everything back up.
Yeah.
So everything's prolapsed for me. My bladder is prolapsed, my uterus is prolapsed, and now retroverted. Hang on. Which is which? One goes forward. It used to go forward. No, it used to go forward, now it goes back. And it's come in a bit, so it's prolapsed and then retroverted, which means now it sits on my bowel. And so that will fall into my pelvis first. Oh, happiness. Oh, joy. Nanda Maharaj, baby boy, had nothing to do with this. When did she realize she had a prolapse? She felt, okay, so she felt heavy. She felt this heaviness. She had trouble getting up and walking to the toilet. And then, so she was mentioning this to me, and then maybe a day or two later, I get these photographs, and you can see the photographs that I shared where you can see it's purpley blue. So, with this, I know. And again, let me see if I can find that. I suppose you're looking for it, are you? No. busted. She's texting on her phone to her boyfriend while in the middle of class. Jesus. Yeah, it was Rada. They make, it
Thank you for.
was Rada Kun and her boyfriend. Okay, so. I know I was saying something else, but you put the pessary in. Oh, I was telling you, yeah, that's what I was saying. So the pessary goes in, but the trouble, it's weird. It didn't feel right. It would catch my urethra, which is also prolapsed. And it just
It's in the way.
was there. It was just there.
And you would know it. You're very aware.
Oh, yeah, man, you walk in. I didn't like it. So apparently it does help a lot of women.
Yeah.
So I did look it up and indeed, this is what they recommend, pessaries.
Is it flexible to move with you and not?
It's in
a
theory,
certain
yeah, it's just supposed to be a soft thin. You know, if you go inside yourself, you can feel what you're like, right? You know what you feel like. So it goes up into all of that. And it just opens up. And I think one was put into me and that was okay. I think you could forget about the first one that went in. But afterwards, it was never good. Oh, I remember I got a urinary tract infection.
From that?
From the first one that went in nicely, I got a major urinary tract infection. Yeah, I got really, really sick and ended up in the hospital. Now I recover. But I tried it again like a good little girl under doctor's recommendation. And it didn't feel good. Yeah. Yeah, I know. That's why I say what women. Kegels, I kid you not. It's worth it. Do those damn things. When did she realize she had, okay. So, yeah, then just maybe 2 weeks ago now, I reckon. Or a bit more, maybe. Yeah, behind the times.
Do you think you could try these rings for her, Lali?
It's possible. This is what could be suggested. It could help, help some. So, but I'm worried it's going to increase infection. So part of the deal was you were supposed to take it out every single day, wash it, do something to it and put it back in.
That's what
Which
you
is where I
actually-
had trouble. And the second time I tried to put it back in, it didn't feel, it pinched me, you know, it got me. You know, by getting me, I mean, it's either the edge of my cervix or it was my urethra and I did not like it. And again, I just got sick. So I'd be worried about, that's why I worried about it. I can see, and it's, you know, I write it down. Okay, this is one possibility. I know these other possibilities. When we discussed with the homeopathic, we discussed that from what I can see of this woman, she easily has complaints. How can I say this? She always has worries. There's always something she's worried about. Again, I'm used in India, they do this all the time. They're always worried about something, but foreigners don't usually do this. But she does. You know, she's one who was concerned about heart palpitations, and then she went off on parikram.
There must be some insecurities there.
Exactly right. So the things that I felt from her was a weakness. I felt that she was easily influenced, frightened. I wasn't sure if she was 100% convinced by her own complaint. Like for instance, I'm having trouble with my heart, but then I go out on parikram. And in fact, in the beginning, when she was telling me, complaining about this heavy feeling, well, she went around, circumambulated campus 3 times. So yeah. So I listen to what people say and then I watch what they do. And then you have to kind of come up with, well, what's really going on here? I also know that our inner emotions create physical conditions for real. I mean, again, that's what blood pressure is all about. You know, things like this. There's some other tests that fight and fright, you know, the release of adrenaline. These are all based on emotion. So emotions do play a role and have a physical play out picture. So based on that, the recommendations that were given and have been given to her are pulsatilla. I think she wanted 1 mil, which I would have given. CPO was also mentioned, and staphysagria, I believe, but I'll look that up. Is there anything you could do with nutrition? I don't know. We're looking at the salt. We're looking at, well, I mentioned the Kegels. I had her in the knee. That's also what Anne Fry says straight away, knee check, being anxious. Yes, exactly. And that, a person who's easily influenced, that's the pulsatilla personality. So on homeopathics, there's a personality picture that goes with the remedy, right? The type of person. So it's also the symptoms, like is it a hot red swelling, or is it cool to the touch? Are you, how do you feel when you see darkness outside your window? There's actually, and when I would never have thought to ask such a question, are you frightened by the darkness outside? Only outside my window. What's my daughter's reply? So she gets a different remedy based on being fearful looking out a dark window. So things like this. Okay, so you mentioned tissue, and I think tissue salt came up. Actually, the homeopathic did mention tissue salts. And that's exactly right, is what you would with homeopathics, because when you go on the small doses, these are the tissue salt doses. When you're getting to like 30 or even 6x, these are the small doses of homeopathics. They're so fine that they are more on a tissue salt level than just a, a little more fine and subtle. But on those types of situations, that subtleness can be what you need. Again, it depends on your person. When I look at this particular woman, I can see that you go gentle with her. For me, get me down on the ground and just pump me, punch me into submission give me 1 mil every time. So you look at people like this, that's how you work with, it's real. So, or at least this is the art or how we work with homeopathics. I do have concern for her. I don't know where this is gonna go. As I say, I haven't really I've never dealt with a bladder prolapse. I do.
You done for her?
Yeah, and I did look into it for me, and I turned away and
Expensive.
ran. It's scary.
It's scary, it's expensive or both.
Scary. It's Australia. I don't pay a dime.
Okay.
So I think I can go in and get the surgery, but no, and then the lady surgeon sat down and explained it to me. What they're doing isn't full on. I was actually looking at a hysterectomy. And then she goes, well, once you do the hysterectomy, then you have to hold up the cervix, and then you have to do something with the fallopian tubes if you keep the tubes. And then even then that's there, but then the bladder's just gonna want to fall and the rectum's gonna want to fall. So they both have to be held back up with fabric that gets sewn in, and it's the same fabric that got recalled for breast implants, but it's been okayed for the slings. So I said, no, thank you. I think I'll go back to dragging my uterus in a bag behind me.
There's a documentary about the surgeries they were doing for like bladder prolapse. I don't know the material they were using, but they would like kind of put it and like try to like hold it up against the uterus, but then it would make a tissue fuse and like all the scar tissue would develop. And then you couldn't separate them anymore because there's like, I don't know, like bars and concrete, that kind of. Yeah. Oh, yeah.
I have been a doctor, and she actually suggested that I do what is it called? What is it called? Hysterectomy for instead of birth control, because that's the safest. It's just a small
It's
surgery.
not
It's-
fucking safe.
It's
It fucks with your hormones, but it actually fucks with your hormones. It's really, really.
That's the other thing.
Yeah.
Yes, that's why I didn't do it.
felt like it's the
That's why
best.
they actually encourage you to keep your fallopian tubes and your ovaries, because then like your body is still trying to mimic the like some hormones. If you get a full like